Good morning. The meeting's now live.
Thank you very much, Anna. Welcome everyone to this meeting of the Health and Wellbeing Board. Just going to the agenda. So, do we have any apologies for absence?
I've got Dr. Nick Moore, Mark Cubban, Francis Mullen from Portsmouth College. Alison Jeffrey will be an hour late due to another meeting, and Roger Batterbury, but he's represented by Siobhan McCurra.
Thank you very much, Anna. Thank you for that. And Ines has just arrived, so welcome Ines as well. Are there any declarations of interest on any of the items today? Okay, as there's a number of us in the room, this is a live meeting, so if we can just go round and introduce ourselves, I think that would be very helpful. So I'll just go down the list of people who are here. So if you can just introduce yourselves as they go. So I'm Matthew Winnington. I'm the Joint Chair of the Health Wellbeing Board, and I'm the Cabinet Member for Health, Wellbeing and Social Care at Portsmouth City Council. Helen.
Thank you, Councillor Winton. I'm Helen Atkinson, and I'm the Director of Public Health for Portsmouth.
Sarah Beattie.
Hello, Sarah Beattie, Head of Southampton, Portsmouth and Isle of Wight for the National Probation Service.
Thank you, Sarah. David Goosey.
Good morning, Councillor Willington. David Goosey, I'm the Chair of the Portsmouth Safeguarding Adults Board.
Thank you. Diane Sherlock.
Good morning, everybody. I'm Diane Sherlock, CEO of Age UK Portsmouth, and here to represent the voluntary and community sector. Thank you.
Susie.
Good morning. My name is Councillor Susie Horton, and I'm the Cabinet Member for Children, Families and Education.
Jacqueline Markey.
Hi, my name is Jacqueline Markey. I'm Community Director for Hampshire and Isle of Wight Community Rehabilitation Company with responsibility for the East Hub, which is the Portsmouth Fareham area.
Thank you, Jacqueline. Alison Lawrence.
Hi, I'm Alison Lawrence. I'm the Board Manager for the Portsmouth Safeguarding Adults Board, just here supporting David Goosey with that item.
Thank you, Alison. Dom Latouze.
Hello, I'm Dominique Latouze, Consultant in Public Health for Portsmouth City Council, here to present a paper on physical activity today.
Thank you, Dom. Anna Martin.
Anna Martin, Democratic Services.
Thank you. Robert Mitchell.
Yeah, good morning. I'm Robert Mitchell, Chief Inspector, Deputy Police Commander for Portsmouth.
Thank you, Robert. Kelly Nash.
Good morning, I'm Kelly Nash from the Corporate Strategy Unit of the City Council, providing general support to the board.
Linda Colley.
Good morning, Linda Colley, GP, Chief Clinical Officer and Clinical Leader for Portsmouth CCG and Joint Chair of the Health and Wellbeing Board.
Jackie Powell.
Hello, Jackie Powell, one of the lay members for Portsmouth CCG.
Ines.
Good morning, Ines Richards, Chief of Health and Care Portsmouth for NHS Portsmouth CCG and Portsmouth City Council.
Susanna Rosenberg.
Susanna Rosenberg, Chief Operating Officer for Solent NHS Trust.
Siobhan McCurra.
Hello everyone, Siobhan McCurra, Manager of Healthwatch Portsmouth, representing Healthwatch Portsmouth today. Roger Batterbury is unavailable.
Thank you, Siobhan. Jeanette.
Councillor Jeanette Smith, opposition spokesperson on children's and adults for the Progressive Portsmouth People Party. Group, I should say, not party.
Judith.
Judith Smythe, Portsmouth City Councillor, co-opted onto the Health and Wellbeing Board.
Steve Ash.
Steve Ash from Hampshire Fire, responsible for fire service in Portsmouth, Havant and East Hants areas.
Thank you, Steve. Gerald.
Good morning, Gerald Burn Jackson, leader of the council.
David Williams.
Morning, everybody. David Williams, Chief Executive of the City Council and Board Member of the Portsmouth CCG.
And last but very much not least, Fiona Wright.
Fiona Wright, Consultant in Public Health and Co-Chair of the Portsmouth Mental Health Alliance.
Thank you very much and welcome everyone today, and thank you for bearing with us on our long list of attendees today. So on to agenda item number 3, minutes of the previous meeting held on the 23rd of September 2020. So it's recommended that the minutes of the previous Health and Wellbeing Board meeting held on the 23rd of September 2020 be approved as a correct record. Is everyone happy with that?
Yes.
I don't see anyone with any dissent, so that is agreed. Thank you very much, everyone. Right, so over to David Goosey for item number 4, the Portsmouth Safeguarding Adults Board Annual Report. Over to you, David.
Thank you. Can I just say it just feels a bit odd making a report or making a presentation of a report that finished in March this year about last year, when so much has happened since March. There's so much water under the bridge that the 1920 year just seems like it's irrelevant, but putting that aside, we have a shortish annual report this year focusing on some of the key issues that the board has been involved in, principally around the 7 key priorities that make up the business plan for the year. And it's useful to note that the business plan in fact comes to an end at the end of this financial year in March 2021. In respect of progress against some of those business items, I think it's probably appropriate to say that the most significant progress was achieved in respect of items 1, 2 and 4, that is making some improvements about the use of the Mental Capacity Act and the deprivation of liberty standards in practice, working with some of the care providers in respect of residential homes to move them from requires improvement to good, and developing a new transitions policy for young people moving from children's services into adult services. We've made some progress in some of the other areas, but not as much as in those 3. And indeed, it's striking. I took up the post about a year ago, in fact, and one of the things that I noticed, I think, was that the business plan probably needed to be more aspirational. And so we have been working recently to establish a new set of strategic priorities for the Portsmouth Adult Safeguarding Board. And I'm hoping that this time next year, when we present some a report on the work this year, that we'll be able to tell you all about that new plan. And indeed, it's key, I think, to say that we probably need to align it much more closely with the work of the Health and Wellbeing Board. And I think it's appropriate also to say that it ought to be aligned with some of the other work that goes on across the city, perhaps with the Safer Communities Partnership and with health and social care more generally. I would like to see that the work of the board is raised in terms of its profile in the city, and that we put safeguarding adults a little bit more on the map. And by saying that, I hope that we are able to develop a strategy which is more outcome focused. I think at the moment, if you look at the key priorities that we've been working to, they tend to be inward looking. And so I'm looking for a more aspirational approach to safeguarding adults in the city. and indeed would be interested to hear some views from the board about how the Safeguarding Adults Board can be more closely aligned with the Health and Wellbeing Board. In a sense, I think it's probably not enough that we present retrospectively the work done several months ago, in fact almost years ago, and it might be more interesting and useful to both this board and the Portsmouth Safeguarding Adults Board that we're more proactive in the activities together. You'll note also from the report that neglect seems to be one of the key issues that face adults at risk in respect of the types of difficulties that they face, and of the 1,500 or so referrals into the system for safeguarding adults, nearly 60% of those instances involved neglect or self-neglect in one way or another. And I think that's probably illustrative of where we need to potentially pitch some of the new strategic priorities for adult safeguarding, and perhaps even to include some of those groups which may have not always received the attention that they may have deserved in the past. And I'm thinking particularly of perhaps the groups of people who make up our homeless population. And we know, don't we, through the COVID process, that we've learned much more about that group than we've ever known before. Similarly, I think it's possible that we can focus some more strategic priority on those adults who use drugs and alcohol, and their lives are worse as a consequence of some of that activity. And I'm keen perhaps that we might focus on some of those hitherto perhaps neglected groups in the city, and I'm looking forward to being able to present some new strategic priorities to this board at the appropriate time. Shall I pause there, Councillor Willington, and if there are any questions, I'm happy to take them.
Thank you very much, David. Are there any questions for David around this report? Jackie Powell.
Hello. Actually, I thought this was a really good report. I was thinking that actually it's very proactive, and I liked our approach, but I really congratulate you on your ambition then to really keep pushing the safeguarding agenda. I think it's incredibly important. And I found this report very easy to read, actually, and very helpful to me. But I take on board that, you know, bringing something back to the Health and Wellbeing Board on a regular basis that keeps us in touch with here and now would be very helpful. Having said all that, the thing that I wanted to comment on, or a bit of clarification, was on page 16 of this report. It was noted that there's been 607 instances of hate crime. And I just wanted some sort of sense of, is that better, is that worse? Is that something that's also part of the reporting and how we tackle it?
I'm probably not able to give you much more information about that than what's in the report, but I think it's a very important point that you make, looking at the issues to do with hate crime. I might defer to my colleague from Hampshire Police to see whether he's able to offer any further light on the matter, but I do take the point that it probably does need more attention.
Yeah, hello Jacqueline, it's Rob Mitchell here from Hampshire Police. Hi. But bearing in mind the data that David's got in the report is old data, and what I'm working on at the moment, actually we discussed with our independent advisory group 2 nights ago. Generally speaking, since COVID's restrictions and limitations came in, there has been an increase in hate crime reporting across the country. And indeed, Hampshire as a whole has seen quite a large increase in that reporting. Oddly, Portsmouth hasn't. Year to date, we've seen barely a 2% rise in hate crime. On the face of it, that sounds good, but it's not good, because we know it's happening. And to me, with my inquisitive mind, that means that we're probably not getting enough reports coming through. We're working with our cohesion officer and partners to generate more third-party reporting centres to cover the whole gambit of hate crime, and that's hitting disabilities as well as race and sexuality as well. But I think generally the theme is, in the last 12 months, there's been an increase in hate crime, an awful lot of finger pointing and blaming others for all kinds of things, either politics or inequalities or even health outcomes like the cause of the COVID virus. We haven't seen that rise in Portsmouth that we've seen in other places, and I think that means we've got more work to do to encourage people to report hate crime when it's happening. So we're not complacent, but yes, we haven't seen the rise everywhere else, but there's more to be done to get that confidence.
Thank you, that's very, very helpful.
Thank you, Rob and David, for that. David Williams.
Thank you, Chairman. I do welcome David's emphasis on the sort of progressive rather than just the retrospective. I think one of the things that will give us an opportunity to explore that in slightly rounder terms will be the emergence of the work that's been going on across the city around the vision for Portsmouth. And I have to say, I've been very encouraged by the extent to which the compassion of the city, the need for offering sanctuary, ensuring people feel secure and supported within our city is coming through in that. And I'm sure before long we will be bringing material to this board to explore how this board relates to that agenda. A huge synergy, huge overlap, albeit that the vision's slightly broader. But I think that might give us an opportunity to have that discussion, David, about how does that then cascade with the other groupings that feed into this board and report to this board. But I do welcome your suggestions. Thank you.
Thank you.
Thank you very much, David. And just building on that as well, I think that for David Goosey, I think with the Safeguarding Adults Board, I think there's certainly every opportunity. I think it's a really good idea to expand into having chats about any specific issues you'd like to do with whether they fall within adult social care, public health, housing, anything like that. Is to have those conversations at any point with any part of the team. I think that we'd be more than happy for those to happen as well, as an ongoing process. And I certainly think connecting everything up, especially with things like with homeless people and people who are suffering from drug and alcohol abuse, is certainly something we can make the most of in terms of making sure we're all connected up. So and I agree, and I think having how we connect that in with all of the boards, and we've heard from obviously David and we've heard from Rob, with two of the key partners within the board, but I think that's a really important part as well. Judith.
I'm really glad that we're going to be focusing on genuine outcomes rather than sort of ticking off activities on a list that may or may not make a difference in our future strategy. And as soon as you start doing that with something like adult safeguarding, it's absolutely clear that we're not building a to-do list then for adult social care. In most cases, we're building a to-do list for all the other partners. And I'm thinking particularly about some of the work that was done some years ago about reducing suicides and the importance there of getting to people before they get to the point of having suicidal thoughts and also before they get into any sort of mental health care service. A lot of this sort of work has to be done much earlier on in the community and link very closely with work in children's services and adolescent mental health services. So I really think this is the right direction to go. And I think linking it to the Portsmouth strategy work that's being done, the vision for Portsmouth, is extremely sound. And particularly with COVID having happened or still happening, it should give us a really big push to look at this issue, these outcomes, in a holistic, interagency way, only towards down the road deciding who's going to do what.
Thank you, Judith. Do we have any other questions or comments on this item? Okay. Thank you very much for that, David. It's a very comprehensive report, and look forward to seeing you again and having discussions outside this meeting as well for the rest of the year. But I think yet again, and I'd like to thank you personally. You, as you say, you came in a year ago, and you've been doing sterling work on the safeguarding adults board in what is extremely difficult circumstances, which has been effectively unprecedented. So to have been thrown into that only a few months into your first year as chair of the safeguarding adults board, and you've handled it very well. So I'd like to express my thanks and the thanks of the whole of the board and the city for the work you've been doing on that.
Thank you.
Okay, so on to item number 5, local outbreak engagement boards activity related to the pandemic. So over to you, Kelly.
Thank you, Councillor Winnington. The report is just an information report and is part of the regular updates that we're bringing to the Health and Wellbeing Board on the activity of the local outbreak engagement board, which was obviously established as a subgroup of this committee. Hence, we report it back on a regular basis. The background for the board is in the report, so I won't go over that, but just to confirm that since we last received a report of this board, the subgroup have been considering work across a range of areas related to our pandemic response, including changes to powers and regulations, of which there have been quite a few, our local contract tracing work, testing, and our testing and trace support payment arrangements as well. We've also asked the board to consider the local escalation framework, which in effect sets out the measures that will be in place in the city at a given time, the support that needs to wrap around those from the city to ensure they can be successfully implemented, and then the communications that we need to align with those measures to make sure that the messages are reaching everyone they need to. And the board have been really supportive in kind of providing views on that as well. There will be a further extraordinary meeting of the board on the 1st of December to obviously brief on what's happening when we merge from national regulations into a local tier. So that'll be a really helpful discussion. So as I said, it's just an information report to bring everyone up to speed with what's been doing, although obviously yourself, Chair, and other members of the board are also members of the subgroup and may well wish to make further comments. But yeah, I'll leave it there. Thank you.
Thank you very much, Kelly. Judith.
The sort of statutory purpose of the board is to give stakeholders the opportunity to be engaged in the board, to oversee and to see if we're reassured or not by what is being done by all the many partners that are there. And I think just to give you that reassurance, we do ask some searching questions and we do go through things in some detail. And it's been more testing that in the last meeting when our COVID, the incidence of COVID in the city has gone up so steeply. But I think it's fair to say, and if others wanted to chip in, that we are reassured that we're doing all we can here, and particularly we're full of gratitude and admiration for the solid foundation of interagency work that means that it does seem to be a very seamless process and people working very hard, but there seems to have been a remarkably good clear lines of sight down through all the agencies that are helping to us to cope with the COVID pandemic, even now we've got high numbers. So I just wanted to say that the purpose of the board statutorily is for us to be reassured about those things, and I am reassured, and I think we're doing what we can.
Thank you, Judith. Any other comments or questions? So, as the chair of the Outbreak Engagement Board, as well as the chair of this board, I'd like to echo what Judith has said, but also really make that emphasis that the work, the joint working that's going on during the pandemic is built on those years of joint working that we've all been working together as agencies and organisations within the city over many years, and I think it one of the things that comes out in the things that we get at the Outbreak Engagement Board is how that local partnership working has really made an impact and really does make a difference compared to, and the feedback we get from other places is that in the country is that they often ask, how do we do it? And of course our answer is, we've been doing this for many years, plus the additional partnership working we brought on stream and that's come even closer together during the pandemic has really made a difference there. Obviously we're going to know tomorrow what tier we're going to be in post the end of national lockdown next week, and again having this board as a statutory board, but we've made it, I think, more than the statutory minimum, but by far, by having some really key partners within the city's system to ask those questions and to make sure that issues that we are bringing up that we think aren't being addressed by national government can be fed up that way as well, which again is really important, because having that laser focus on Portsmouth really makes a difference, and us all pulling together, because that gives us a much stronger voice when we're saying up the line things need to change, or this is a good way of doing things. So I'd like to thank all the members of the subgroup and thank Kelly for bringing this report here today, and for her and for the officers' work as well, because pulling that together, and so for Kelly and Helen and Andy and all the other officers who have been involved in putting the report together and making sure that what we're seeing is things that is a true reflection of all that partnership working across the cities is really important for us, and to be able to feel like what we push back on in those meetings really has some impact as well. So thank you everyone for that. Okay, so move on to agenda item number 6, and it's Plan for Health and Care Portsmouth. Over to you, Innes.
Thank you, Councillor Winnington. Some members will probably recall that around in 2015, the partnership of health and care organisations in the city that we refer to as Health and Care Portsmouth set out its commitments and a blueprint, if you like, for the future of health and care in this city, and these have informed and shaped everything we've done over the past 5 years. During this year, in 2020, we've been reviewing and refreshing these commitments and the plans that exist to deliver them. And what you're seeing before you today is a drawing together of the current state of play of those existing plans. And I do want to stress that point, because the point of that is to co-produce and engage the next version of these as well. So what we're not bringing today is a finished plan for signing and sealing. This is the beginning of a process to encourage that wider engagement, and already in the discussion this morning, and I suspect on next agenda items, we'll be having a discussion about how these things connect. That's the point of doing this as well. Just to give you a little bit of a brief overview of what's in the paper, I am not going to go through every single page of it, all the appendices. You'll be relieved to hear, Chair, as well. I do commend people giving the time to reading this as well. It's a good start to this. What we have here is an initial revision of the original blueprint commitment. That's Appendix 1. These were the original principles, if you like, that Health and Care Portsmouth established itself on and set out to do, with some suggested refreshments and to bring these up to date. And I'm inviting members to comment on those either in this session or directly to me afterwards. We also have a summary of all the work that's been going on in children and families under the coordination of the Children's Trust. And there's a number of differing strategies there that range across a broad number of issues. These should be well known to us in the city as well. We also have a first take of the public health priorities, because public health priorities are important and cut across everything we do, and we're very keen to make sure that they are strongly embedded in this plan. And we also have the first drafts of the adults strategies as well. In there, the 6 strategies and these 7 areas that we think across all of those strategies and need to be embedded, including, I would stress, the adult safeguarding strategy as well. Taking our lead from the work of the Children's Trust, we are embedding the learning from COVID-19 in each of those strategies, because some of those will be unique to the specific areas and some of those will be general, and these are explicitly referenced in there. And we're also doing some work to try and just align how we present these strategies so that they broadly look similar across all of them as well, to get some integration going there as well. We've already mentioned the importance of the city vision work, and there is ongoing conversations about connecting those. And we also have noted that there's an opportunity in the refresh of the health and wellbeing strategy, which of course covers a much broader set of priorities, to do further connection between that and this work here as well. When the CCG board discussed this a couple of weeks ago, obviously very supportive of this work, wants to be engaged in this work as well. Just for members' information, really, there were 3 areas that the board was saying actually we could strengthen in here. One is we could strengthen our focus on inequalities. From an NHS perspective, as the NHS moves to integrated care systems based on broader geographies, the CCG board felt it was very important that the city was very aligned and very clear about the specific inequalities that Portsmouth face and where there is difference and why sometimes we need to do things differently. The second area was around being clearer about when we work, when it is right to work in the city and when it is right to work in different levels. So the most obvious one we will be familiar with is around our hospital with our partners in Hampshire, and when it is right to work at a Hampshire and Isle of Wight level, but there are other partnerships and levels as well, and we need to do some work just clarifying that. And then the third area the CCG board were particularly drawn to was in the mental health strategy presented here. It introduces the concept of no wrong front door, and they felt that was a good principle that could be adopted across a wider set of strategies, so that from a resident's perspective there is no wrong front door, that we have set ourselves up so that when people approach us for help, that they get the help that is right for them, no matter where they've made first contact, which I think is a good aspiration for the city. Councillor Winnington, I was going to stop there. Quite happy to take general questions on these. If I don't know the answer, I usually know who we can get to answer it. Thank you.
Thanks very much, Dennis. Any questions or comments on this item? Judith.
Chair, if there's anybody else who wants to go first, I seem to have jumped in each time.
In which case, I'll go with Siobhan.
Okay, thank you very much. Hello, everybody. Hello, Ines. I've had a look at the plan and got a number of issues that Healthwatch Portsmouth would like to raise. So it may be helpful to put those in a follow-up email rather than hog the limelight now, because I'm sure other people will have things they wish to raise as well. But just to give a flavour, in terms of the carers support, we've actually got a survey out at the moment looking at how COVID has impacted on carers. Some people have become carers overnight. And they are not aware of perhaps the services that are available to them. So that's coming. We hope to have early responses before Christmas, and then we'll hopefully have the final report. We'll finish the data towards the end of January and a report in February. So hopefully that will be timely for Health and Care Portsmouth. Be very happy to share the results with you. With regard to the learning disability health checks, there's a target of 67% annual health checks. Is that because of COVID and the need for socially distanced annual health checks, or is there some other reason for that? And if you're wanting to come back to us on that, that's fine. With regard to Positive Minds, we see that there is a proposal to change the support offered from low-level anxiety to mental health, so SMIs, and so we want to look at, well, what is the support available for people who do have the low-level anxiety? Where do they go if they can't be supported by Talking Change? Very pleased to hear about the idea from the CCG board about no wrong front door, and I think if that could be included in the proposal for Positive Minds for the alteration, that may help people feel more confident that the service is providing that initial point of contact. So I think that would be a great addition to the Positive Minds plan. With CAMS, well, Children and Young People's, page 80, there is a proposal that for children and young people, we presume this is CAMS, they are to be seen within 4 hours. Is this a phone call to register that they're on the waiting list, or is this actually support? So we need to know how that is manifested. And delighted to see that MEC, Make Every Contact Count, is making an appearance in the adult care priorities. Was wondering, in the workforce and the primary care work, if MEC can be given a higher priority in terms of rollout for frontline staff, if that already hasn't been part of the process, and indeed to the voluntary sector. Healthwatch Portsmouth very recently had MEC training, found it very useful, and we'll be asking people's opinions through social media. How have you found it? To encourage more interest in accessing the MEC training, which is very good, by the way. So I can stop there. But if there are items that you want to come back with subsequently, then it's absolutely fine.
Thank you, Siobhan. Yes, I will come back to you on a couple of those items.
Lovely.
I'll consult with the right people. And if you did want to still drop a full email to me, then more than happy to receive that as well. Okay. Completely agree with you on the carer support comments we're making. That has been one of the impacts of COVID-19. I think the survey that you're referring to would be incredibly useful in shaping these plans. So super. I'd be really happy to work with you over the next few months to see how we can incorporate that in as well. It's another one of those issues that will just affect every bit of this work, I think, as well. But I will get back to you on the detailed information.
Super.
On that.
Thank you.
Thank you, Siobhan and Innes. Judith.
Thank you, Chair. I think one of the strengths of the children's plan was that it did actually move us towards measuring the success of the strategy through measuring outcomes, measuring impact on children. In some ways, that's a little bit easier to do in children's plans than it is with adults. But I do think that the text we've got at the moment, I'm looking, for example, at page 36 through to 42, are really very, as the chair of the Adult Safeguarding Board saying, inward looking. And I think if we worked a little bit just to turn them round, we would have a much more outcome driven strategy. There's quite a lot of the things we talk about here, improving this, supporting that, which makes me say, so what? And I usually apply, when I'm writing a strategy, the so what test. If I can't immediately say what the impact of that will be on actual people's outcomes, their quality of life, morbidity, mortality, then I do start thinking then it needs to be rephrased. Particularly giving just an example, 6 on page 37 is a particularly good way to illustrate what I'm trying to say here. Improving access is never, in my mind, an objective. To start with, if you get the wrong people who are not in need, the worried well turning up, you overwhelm the service, and that's not a very good idea. Second of all, if you can have people turning up in their droves and not getting the service they want, either being referred away, triaged away, or literally having a poor service when they get there. So I don't really see that improving access should ever be a strategic objective. By absolutely counting the numbers of people who are affected by good whose health is improved, whose lives are improved by good services, absolutely is. Counting the number of people who turn up and get the right support, there are other ways of measuring it. So I just think some of these things need tweaking a little bit. And if you wanted just a little, somebody else have a look at it, I'd be happy to do so. They can all be turned around. Using the word improving is an interesting one, because one person's improvement is another person's something got worse sometimes. So I think the language is very important, and we haven't quite got it right.
Yes, and thank you. Yes, I mean, I agree with you. I think what we are I know what we are trying to do is to emulate the approach that the Children's Trust is taking, and for adults get a far more outcome focused way of working and plan. I think one of the things, and children's would have had this challenge as well, one of the challenges we've got in adults is we are trying to marry NHS strategic priorities alongside these other broader priorities, and as you all know, NHS strategic priorities, improving access is an excellent example. We'll count numbers of people coming through doors. That's just how the NHS assures itself quite often. It's less, dare I say it, focused on outcomes, but the rationale for doing this was to engage this wider set of partners through this board and others to influence that, so that in the city we become far more outcome focused. We will never ever, I don't think, escape the need to assure the NHS around numbers coming through doors, but if that was a secondary or even tertiary, much lower down the list focus for us in the city, and we were more focused on the outcomes of the people once they've been through the door or whatever, then I think that would be a good result for this plan. So in summary, I completely agree. It is under the outcomes focus is underdeveloped in the adult section, but that was one of the reasons we wanted to bring this out into this light.
I do absolutely understand that, as you can imagine, Innes, but I think identifying priorities can be about what the activity that you're going to do and the things that the NHS needs to be satisfied on, and many of those things are indeed getting a bit more outcome focused from the centre, or were. But I think it needs to be there need to be some measurable outcomes at the front of this strategy that help us to understand what you're trying to do with the strategic priorities, which is not the same as the strategy. And there are some quite well trodden and quite simple lists that can be used that immediately give it an outcome focus against which you can judge some of the decisions to take one action against another lower down in the strategy.
David Williams.
Thank you, Chad. Just one comment. I think this is coming on really well, and I know that there are improvements that we can make in terms of its focus and so on and so forth. One of the issues that we've been wrestling with over the last, it seems like forever, but over the last few years, has been finding the appropriate interfaces between the work that we're doing in and for Portsmouth with the wider geographies, particularly Portsmouth and South East Hants around the hospitals footprint, and the wider Hampshire and Isle of Wight geography. And I do feel that sometimes there's and I have to say, a misguided feeling that Portsmouth it isn't perhaps being seen to play into that as much as it should do. I think in actual fact, I think we're being asked to find the solutions for the broader geography on the basis that we appear to have found some solutions for our smaller geography. That aside, whilst I fully acknowledge, and I think we should celebrate the fact that this document is very much focused on better outcomes for Portsmouth people, and unashamedly so, I do wonder whether, just to help address some of the unfortunate commentary that is in the wings, we say something quite simple and quite overt about the extent to which we do fully play into the bigger geographies where that is most appropriate. And I think that, unfortunately, a lot of these things operate on a tick box basis, and that might be a tick in one of the boxes.
I agree, David, and that very much echoes the sentiment of the CCG board discussions as well, and we will incorporate that into the messaging and into this plan.
Thank you.
Thank you. Any other comments or questions on this report? Okay, I think this is for us as a health and wellbeing board and us as a system, so a very wide system in Portsmouth. This is the ongoing bringing together and strategising for health and care. Portsmouth is one of the most important things that we are doing in this city, and again, I pay tribute to all the organisations that are involved with that explicitly, but also all the other organisations, including everyone here who feeds in and brings everyone together, because if it wasn't for the whole of the city coming together, we wouldn't be in the situation whereby we are having this strategy and we're able to bring statutory functions closer and closer together, because that buy-in from all the organisations, whether it be voluntary community sector, whether it be business sector, whether it be the schools, police, fire service, all the other statutory organisations, without their understanding that we work together and that they can go to different parts of the health and social care system, it wouldn't be possible to do this. I completely understand and get where David and Ines have just been talking about, but also we have to be very conscious that we're in an uncertain situation in terms of how things are going to be imposed from above, or attempted to be imposed from above, on health and social care. And the best way we can make sure that things stay focused on Portsmouth is by bringing ourselves closer and closer together and working together, because it makes it a lot more difficult to unpick things if we're working closely together, which we are on a daily basis. But there is always pressure from outside. Do not be fooled that that isn't the case. There is constant pressure from outside for us to turn away from looking at Portsmouth as our focus, and with other people coming in and trying to do to us rather than us doing together and us pushing upwards. So it really is a critical part of what we're doing. So Siobhan, you wanted to come in again.
Thank you very much. Just to follow on with that point, thank you, Councillor Winnington, that the bringing together in Portsmouth is an essential tool that we seem to do extremely well at. When things, dare I say it, are more normalised later on in the year, would it be possible for another project bridge to be organised? Because that is a great example of the bringing together of the statutory, the voluntary sector and the supporting partners. It seems, having been to a few of these, a very good mechanism for identifying key ways of achieving shared goals. So I just wanted to say that, having heard you talk about the partnership that we enjoy in the city. Thank you.
Thank you, Siobhan. I think that's a wonderful idea. I think there were a few project bridges in the pipeline that unfortunately have not been able to take place because of the pandemic. So certainly, I think by the time we can do those again, it would be absolutely the right time, because we'll have more clarity as well. There's lots of though we're still waiting, for example, for a social care white paper, and we've still got no dates on that whatsoever from government. Indeed, I was talking to a government minister a few weeks ago. I was at a meeting with other cabinet members for adult social care, and there was still no date, and it was explicitly said that they have no date for that, which is very frustrating. But we do understand there's going to be more stuff around the NHS and bits and pieces coming up in the new year. So that's going to be there'll be a bit more clarity, hopefully, at least in one part of health and social care, even if the other part is still, unfortunately, it's absolutely critical that we get a way forward on adult social care, is still very much lacking. But I think that's a great idea, and we can certainly put together some ideas for I'm sure, as I said, it won't just be this project, but there'll be lots of others, but to make sure we can get that on the radar, and then once we're able to get people together again, then we can start putting that together.
Wonderful, thank you.
Thank you very much for this report. As I say, I really appreciate everyone's work into doing this, and please, if you do have any comments or suggestions, then please do get in contact with Innes and his team, and we can sort of make sure that it's as good a report, as good a strategy as possible moving forwards. Okay, so on to item number 7, and Portsmouth Mental Health Alliance, and over to Fiona Wright. I think Fiona might have dropped off for a moment. Yeah, we currently don't seem to have Fiona on the at the meeting, so I presume she's having some Teams issues. So what I'll suggest we do is move on to the next item, which is the physical activity strategy refresh, and over to Dom the Twos.
Hello, thank you. So this is a paper for information. It gives you a very brief update on the development of the new physical activity strategy for the city. We're aiming to focus on supporting the least active to take some activity, and also to reflect some of the impact of the COVID pandemic and any measures we might take to mitigate those impacts, so that we know that we've got relatively low physical activity levels in the city, and obviously that physical activity can significantly impact on the health and well-being of individuals and life expectancy. So we're defining inactivity as less than 30 minutes of moderate intensity physical activity a week, and we know that across the country that's responsible for 1 in 6 deaths in the UK. Whereas being active can prevent and to manage a number of chronic health conditions. Around 42,000 of the adult population in Portsmouth are inactive, so doing less than 30 minutes of activity a week, and around 4 in 10 young people under 16 are doing less than 30 minutes a day of physical activity. In terms of physical activity in COVID, obviously the pandemic, and we've talked about it a great deal here, has exacerbated existing inequalities, and has also negatively impacted on physical activity levels in terms of people's ability to be physically active, and also the motivation decreasing as lockdown has gone on and subsequent restrictions have been put in place, ultimately resulting in a widening gap between the most and the least active. And we also know that overall older people, people on low income, people in urban areas, and those living alone and who had to shield found it much more difficult to be physically active during this year. In terms of COVID generally, we know that COVID's more likely to disproportionately affect and cause serious illness among BAME groups and those living in the most deprived neighbourhoods, who are also at greater risk of chronic conditions such as cardiovascular disease, type 2 diabetes, obesity and other preventable factors that can be ameliorated through physical activity. And we also know that those obviously who are overweight and obese were more disproportionately affected by COVID. On the plus side, we know that walking and cycling did increase, so active travel increased after the first lockdown. So as I said, pandemic has had an impact on the whole on health inequalities, but there are some opportunities that we can work on from the pandemic, including some of those increases in walking and cycling that we can build further on, and a focus on so-called incidental physical activity. So physical activity you do as a byproduct of something else, for example, active travel to work or to school or around about the city, has huge benefits for health, but also for the environment and the economy. So for example, active travel obviously reduces emissions in terms of air pollutants, helping to tackle climate change and improving air quality. And we know that long-term exposure to air pollution before the pandemic was associated with long-term health conditions and also with exacerbated risk of contracting and developing serious illness from COVID as well. Obviously, walking and cycling can contribute to economic performance in the city by reducing congestion, increasing pedestrian footfall outside shops, and the benefit cost ratio of investments in walking and cycling are estimated as very high value for money. So to the strategy, Energise Me, our regional active partnership, are leading on the strategy's development with our close input. We're launching in early 2021, aiming to tackle activity in those least active, because that's where the evidence shows that the biggest health gain lies, in encouraging people who are completely inactive to take some form of physical activity. We and particularly also focusing on the pandemic and the impacts of the pandemic and that widening gap that I mentioned earlier on in terms of the gap between active and inactive people. So we're currently in a public consultation which runs until the 15th of December, which is taking an online format, partly facilitated by staff if there are queries, but there's also opportunities for focus groups for those people who aren't online. Over the winter, we'll be producing a report and themes arising from that public consultation, and then we'll be holding workshops with key partners, launching the strategy in the spring, which will be a regional strategy. This is also input by the Portsmouth Physical Activity Alliance, which is a multi-agency network of people in the city who have an interest and opportunities to affect change in terms of physical activity. So happy to take any questions on that, but we would intend to bring back a further update on that to another board meeting in the future.
Thank you very much, Dom. Any questions or comments? Jackie.
Hello. Last time we were at board, we spoke at length, I think, about, and I think it comes under this item, about kind of a super zone pilot project that would help with child obesity. And there was a hope that there'd be some meeting so that we could move this forward a little bit. Has there been any development? Because that feels like it would sit very nicely in with what you're talking about here.
Absolutely, yeah. So we did meet with Councillor Horton and Pam Turton, who heads up as Assistant Director for Transport in the city, to talk about the option for school streets as a particular way of encouraging physical activity, walking to school and so on, and also those co-benefits I mentioned about reducing air pollution and so on. We were hoping that some of those school streets, maybe there's an option to fund some of that through the so-called tranche 2 funding of the emergency travel planning monies that came down from the Department for transport, but I understand there's been a pause on that tranche 2 funding. So we have met once, but there's still a bit further to go on that.
So you literally, if funding comes through, to see whether you can take that forward. Is that?
We need to draw up the costings of how much that would cost. I think there are various different options about how expensive or not you make the scheme, and we're looking to Southampton. They've done quite a lot of work on school streets, seemingly on a shoestring, so that's reassuring. A relative shoestring, I should say.
That's helpful, thank you. And I hope it does get pursued.
I'm just going to bring in Alison Jeffrey first. Susie, you had your hands up. I don't know if you meant to put it down again. But on this particular, yeah, she's put it back up. So I'll just come to Alison first and then Susie, and then we'll come to you, Diane.
Thank you very much, Councillor Winnington. I just wanted to ask Dominic about the proposed project around Arundel Court, because that was something we discussed last time, and I think I sort of recognise that the leadership there is very strong, and I just really had hoped that we might be able to make some progress on the particular project around that school. Has there been any further development on that?
So that they were the pilot school for the super zone, and as you said, they've got an excellent strong leadership that were very, very keen on that super zone. So as we discussed last time, what we'd agreed with the school was to pause the super zone work until September 21, because I think as you'll know better than anyone, Alison, the pressures that school are under.
They are, and it's worse than it was last time. One of this last meeting of this group, yes. Okay, fair enough.
So recognising that, we didn't want to burden the school further with sort of requirements. However, if we'd be really keen to discuss options like school streets with them, so that we can take forward a form of active travel and another work with them ahead of the super zone, which we very much hope to pick up as where we left off in September.
Great, thank you.
Thank you, Susie.
Thank you. On that particular scheme, I think it was at the school's request that it was a slight delay for, as we said last time, obvious reasons. But it's probably worth picking up that conversations, because we're living in a time where things change by week, and so it's probably worth revisiting them. On the school streets generally, I mean, Dom is completely right that there was part of the bid for the Emergency Active Travel Fund. Tranche 2 was earmarked, if we were successful, for quite an extensive school streets rollout. The money that we got wasn't as much as we hoped. However, we are working at the moment to see if we can have a modified version of that ambitious plan. So, and as Dom says, I mean, we've met with Southampton, and they seem to be able to do it on quite a modest budget. So we're going to be exploring ways of, even if it's just a few schools who are really, I just think it's really important that we don't miss this opportunity where schools are actually really keen. You're pushing on an open door. So we just need to revise those ambitious plans to a more realistic one, given the amount of money that we got. But it's definitely work is ongoing.
Thanks, Susie. Diane.
Thank you, Councillor. Hello, Dom. Just a quickie. I'm really excited about the prospect of workshops next year. Perhaps, and I'm offering to support you with those, perhaps we could have contact sort of slightly earlier on so that I can spread the word and ensure that you've got lots of people. We, without doubt, know that older people are very much struggling to get out and about. They've lost a lot of physical ability over the last 8 months, muscle deterioration, etc., and to compound that, sadly, mental health issues around fear of abuse of being older and likely to cause issues around COVID. and fear of actually catching it, flu and anything else that might be around. So it would really be great to work with you. I'd love that, and I know the rest of the voluntary community would too. Thank you.
Thank you, Diane. That would be really valuable input to the strategy, and I'll ask Andrea to get in touch with you to make that happen.
Brilliant. Great.
Judith.
I was going to pick up the question of safe school streets as well, because I think it is important that we make use of the learning that we've had through the COVID lockdown and so forth, with more people walking, more people working from home, and it being easier to walk to school in many cases, to push that forward. But I was also interested in how we're running the city through sort of two strands, the sort of built environment strand and the health, well-being and social care strand and education and things. And I just wondered, and this is a question I suppose for Matthew and Councillor Winnington and Councillor Horton, about how do the wonderful things we talk about in Health and Wellbeing Board and that Dominique has presented to us in terms of more walking about, more pedestrianisation, safer cities, less congestion, better air quality, actually get translated through into real decisions in the environment that are going to make those sort of dramatic and sometimes unpopular decisions.
Thanks, Judith. I think the something to start with is places like the Air Quality Board, which obviously is a partnership between lots of different parts of the council, and that does involve people from public health as well as transport as well as environment, etc. And of course, when we talk about public health, we're talking about everyone's public health, so we're talking about everyone's health and well-being throughout that. And also, obviously, we're working with, we're having conversations, and again, this is where we all come together. We have conversations with the local NHS, because I think I don't know if I said it on this forum before, but actually the most polluting organisation in the entire country is the NHS, because it is the biggest organisation in the whole country, and it's about changing the way that things work in terms of how people get to appointments, about enabling people to have appointments without having to travel, and also about encouraging active travel where you can do to NHS premises, etc. So it's a very, very holistic approach, and I think it is right about talking about how these things work together. But certainly the departments at the council are talking through things like the Clean Air Board and places like that. And also, for example, within public health, we have a dedicated member of staff who is there about around healthy environments. Effectively, that is their role, and they've come in the last year to that role, because we recognise how important it is to join all of that together. So it's not just an abstract; it's actually a practical thing about people's health and well-being, and how that works with built environments, how that works with transport, how that works with the environment as a whole, and talking about things like the super zone. Actually, when that happens, though it's ostensibly around children and a school, it's actually about the entire environment around the school. So it is literally everything, and about how that can be better for everyone who lives in the super zone area, not just about the school children, though of course they're our focus. So it's these kind of projects and these kind of working together that really does make a difference. But it is it's something where, be assured that those conversations are going on day to day to make sure that everything is pulling together, and that it's not just a bit here and a bit there. And it's really important that as we have all these things going on in terms of what's going on with COVID, what's going on with the climate emergency, what's going on with the issues to do with health and wellbeing people in the Portsmouth, some of our long-term health conditions we have, and of course, as Diane's very rightly brought up, thinking about all ages, no matter how young or old people are, and making sure they've got that ability to have, not just be able to access physical activity, but also to live in as healthy a city as possible. So I hope that helps. Any more questions or comments for Dom on this report? Thank you very much for that then. Okay, so Fiona has come back in, so welcome back, Fiona, and so we'll move on to or we'll move back to agenda item number 7, which is Portsmouth Mental Health Alliance. Over to you, Fiona.
Thank you. I'm just going to try and screen share. I hope this works. Can you see that?
No.
Not yet, no.
Okay.
Yeah, that's fantastic.
Yes, we can see that.
Great. Okay, I'll go to the top. Okay, thank you very much. Sorry I dropped out earlier, the hazards of home working. So I'm going to be telling you about the Portsmouth Mental Health Alliance, which is co-chaired by myself and Gordon Mavuti, who's the Director of Partnerships for Solent NHS Trust. And this, I've got a short presentation to try and make it so that you can follow it. It does follow the format of the paper, but I thought it would be helpful to pull out some key points in a presentation, so I've done that. The only bit that doesn't follow the format of the paper is the recommendations, which I've put to the end of the presentation. So the first bit then is, what is the impact of the pandemic on mental health and wellbeing? So as Dom was mentioning, and has been mentioned a number of times, one of the key messages is that COVID is not affecting us as a population equally. There are many inequalities emerging, which has been in the media, in terms of the impact unequally of the pandemic itself. But what we're also clear of is that there's emerging evidence now of the inequalities that are likely to exist in terms of mental health experience. There are a number of longitudinal studies. I must say that the evidence on mental health is slowly emerging. There are a number of longitudinal studies which are showing, for example, that some of the mental health impacts are worse on young people, increasing with the age of that young person, worse on women, and also more likely to impact low-income groups, people who live in urban environments. As you would expect, there are certain groups which are also at high risk, such as people who are working in the health and care system, so key workers, and for example, post ITU, there's a predilection for black and minority ethnic groups. So one key message is that mental health is not equal. The second key message is that we are seeing mental health issues emerging in both people who have had previous experience of mental health issues, but also whole new cohorts of people who have not previously had any mental health issues. And then the third message is that actually the mental health impacts are changing over time. So, for example, the early longitudinal studies showed that a much increase in anxiety just after the first lockdown in March, but then that leveled off. I think it sort of shows the resilience of human beings, that it leveled off, though it's still not back to pre-pandemic levels. Also, we are expecting that many of the mental health impacts will actually come on later on in the, into future months and years. So, for example, related to the wider determinants of debt, poor quality housing, and some of those impacts are going to be seen later down the line. What you've got on this slide here is a sort of visual representation which shows that the mental health impacts are widely impacted across the whole life course. So, for example, in preterm, you'd expect women to have anxiety around their pregnancy, access to care, for example. in the early years, impact of parental stress may be an example. As you go into school, a lot of work has been done locally in working with the schools in terms of the supporting both teachers and parents and children themselves in terms of going back to school and the changes in the school. But there's still some negative impacts in terms of children in school years, for example, being isolated from their friends and changes to their routine. Working age adults, I think some of the key things will be around financial worry as well as changes in sort of home to work life balance. And lastly, in older age, as we've been discussing earlier, there'll be concerns around isolation and also fear of getting COVID itself and the stronger implications for that age group. Examples, other examples, which I won't dwell on, but I think a key one to highlight is the risk to key workers, the risks to delayed diagnoses for other conditions, and the complex bereavement. So to introduce the Mental Health Alliance, again following the structure in your paper, the purpose of this Mental Health Alliance, which was set up in May of this year, was to bring the cities together to improve mental health and well-being, to improve mental health and well-being, sorry, across the whole of the city. The Mental Health Alliance is a collaboration of partners. It works together to improve the mental health and well-being of people both living and working across the city. And it's led by, as I said earlier, by myself from Portsmouth City Council and Gordon Mavuti from Solent NHS Trust. And then Councillor Whittington is a key member of the Alliance with his role obviously as Cabinet member, but also as the mental health champion for the Council. I'd just like to tell you now a bit about the sort of way that we've developed the Alliance and its way of working. So very early on, the wide range of partners that are involved, which decided that given that we are in a collective trauma in terms of the pandemic, that it's appropriate to take a trauma-informed approach to this. You've got some quotes on the trauma-informed approach in your paper. And Mardi Gomi, who's a clinical psychologist at Solent NHS Trust, is a lead on this, and would be happy to give further seminars and expand that work. So part of the trauma-informed approach means basically, I quite like to think of it in terms of doing the opposite of what that particular trauma did. So, for example, in relation to the pandemic, people felt a loss of control. They felt isolated, and therefore, to make this work, we've done the opposite, and therefore we've taken a very bottom-up approach in terms of the way we've developed the Alliance. We've taken a highly collaborative approach, and that seems to be bearing some fruit. So we started with a range of online workshops with all partners. The full list of partners is in the terms of reference, but includes Healthwatch, the Hive, obviously the statutory organisations, local voluntary sector, Solent Mind, Society of St James. So we had thematic workshops, and from that emerged, over a period of time, having presented the evidence as it stood at that point about what the mental health impacts and potential interventions might be, these work streams have emerged. So again, these follow the paper. The first ones were community engagement, trauma-informed approach and communications, which I'll come back to. But what I'd like to just do now is briefly explain these other work streams and give one example, as in your paper, of some of the work that's ongoing. So debt and financial issues, I'm sure everybody here is fully aware of the economic impacts of the pandemic and the clear link that would have with mental health. That's been co-led by the Tackling Poverty Coordinator of the Council and Warren Holland from Solent Mind. And some of the key actions that they've taken to date is to do some training around citizen advice Portsmouth, some prototype training so-called Ask Twice, which is about enabling those people to be skilled up in speaking to clients who approach them around debt issues about their mental health issues. Bereavement, one of the key things, so again, this is led by Paul Beeden, who's a psychologist in a hospice. The issue here is about complex bereavement, people not being able to say goodbye to their loved ones, having multiple issues, suicidal bereavement. So this again, one of the key areas is about training people up, developing protocols to help referrals for complex bereavement, and also linking to the suicide prevention work stream. We plan to commission some services, particularly to support people who are bereaved by suicide. The third thing, Alison Jeffrey's on the call. Stuart McDowell is the link person for children and young people, social, emotional, mental health strategy, and because they have a very established structure there already for the mental health of children. The priority here has been to make sure the two are linked up, but also to look at that well-known transition age between adults and children who often fall between stools. And a key example of the work there is to work towards developing a digital offer for that transition age to extend the current children's digital offer to an older age group. Am I right for time, Councillor Winton?
Yes.
Fine, okay. So the next is workplaces and supporting staff. So the statutory sectors are all obviously undertaking workplace training and support for their staff, and we are pulling some of an overview of that together under the trauma-informed work, which I'll come back to in a minute. But the exciting thing here is about the relationship with Shaping Portsmouth, which is important from the inequalities perspective, because many of our businesses, as you all know, are small, medium enterprises and therefore have low-paid staff, or often at this stage, unemployed or furloughed staff. So the mental health implications of that are strong, and we're developing a strong partnership with Shaping Portsmouth, who, in terms of training and awareness raising in those through the many connections that they have, and also connections with big business who are able, hopefully, to be able to fund some of that work as well. Lastly, suicide prevention. This is very cost-cutting. Suicide prevention goes right across, as people were mentioning earlier, in terms of wanting to get in early with children, for example. There's a strong link, as we know, with debt and financial issues being a major precursor to suicidal ideation. And we're lucky on this work stream to work with Hampshire, Isle of Wight, and Southampton across, and we've got some additional funding, which was for STP suicide prevention work, which, for example, we're taking forward primary care training, as I mentioned, the suicide bereavement commissioning, and some dual diagnosis work. Which brings me on to the last one. Co-occurring conditions is now used to be called dual diagnosis, could be called a number of things, but anyway, it's that tricky issue of where you've got people with both mental health and drug and alcohol substance misuse issues who may often fall between stools. We do actually have some very good practice in Portsmouth of those linkages, better than many other places in the country. However, there's always more work to do. We're seeking some additional funding for some innovative projects in that area. And again, the particular client group for this is the homeless population, where again we have some good practice around healthcare support for the homeless, but nevertheless there's more to do there. Bringing you to the last three cross-cutting areas. So community engagement, I think some of you, Councillor Winton sent around the link to the Black and Minority Ethnic mental health video, which was well attended and chaired by the Mayor. And that's just one example of community engagement work from the Alliance. The trauma-informed approach, I think we see ourselves as wanting to advocate for that trauma-informed approach in the context of a pandemic. And as we say, we have a local expert in terms of Mardi Gomi, and it would be useful to take forward some seminars. The last area is communications, where we have Sterling NHS Trust leading some coordination of communications across the city. So taking the last slide then. So the way forward, again, this fits with the board paper, and basically we plan to build up over the next 6 months, continuing the action we're taking. We will plan to have develop a robust action plan, which is already in development, and to use the evidence base to inform our priorities more strongly, build up on community engagement, the trauma-informed approach, stronger communications, and raise awareness through training. So if there's no further questions, the recommendations are please to note the establishment of the Alliance, to agree the terms of reference with the accountability and reporting to the Health and Wellbeing Board, and to consider how as a board and as members of the board in your organisations you would like to be further involved in, for example, communications, trauma-informed training or approaches, and training in other training such as MEC, or as was mentioned earlier, or suicide prevention training, and raising awareness of the work of the Alliance and other work around mental health. Thank you very much.
Thank you very much. And just building on also Fiona, I'm getting a bit of feedback. Could you mute, please?
Yeah. Sorry.
Thank you. Yes, thank you very much to Fiona, and a special thanks to Fiona, who has done a sterling job in co-chairing the Mental Health Alliance. Fiona is leaving us on Friday after nearly a year in post. So thank you very much for the work, and she'll be handing over to Claire Corrie, who's returning from maternity leave, who is public health consultant as well, who's returned to the council after a year. So great amount of thanks to Fiona for all her work on there. And obviously as the Mental Health Alliance reporting into the Health and Wellbeing Board, it's been really important way of bringing together people within the city to address mental health, especially at this time of particular crisis in COVID-19. Just on the last bit that Fiona talked about there, which was about training and awareness, there will be an email going out to all of you inviting you all to take part in Make Every Contact Count and Connect 5 training, which is just to empower members of the Health Wellbeing Board on mental health, more of that. So that will be going out to you. I've personally done both of those trainings in the past, and they've been absolutely invaluable to me in terms of understanding mental health and how to support people with mental health issues, and also how to promote good mental health as well in terms of seeing off things before they get out of hand. So please do take a look at that email when it comes out to you, and it would be great if as many members of the board as possible could take part in that training. Okay, so open up to questions or comments. So first we've got Rob Mitchell.
Yeah. Hi, this is a quick question for Fiona. Fiona, very good presentation and very encouraging to see all of this work coming together, but particularly with mental health being exacerbated through COVID across all age groups. I think there's going to be a lot of work to do in the coming years over what's happened. Just a quick observation, the graphic on page 2 that showed the life cycles, I wasn't clear when I first read it. It talked about school age and then went to working age. Now I can see it's covered in further slides there, but I just wonder if it needs to be clearer about the student and college population. The bits on the school age don't probably reflect everything to do with that 18 to 25-year-old age group about isolation, away from home, worry about finances with that. I think possibly it's covered in the work bit, but I think to be inclusive, I just wonder whether we need to make it clear school and college age.
Yeah, thank you, Rob. That's a very valid point. I think, you know, the university is on the alliance, and we're working with the university, and we know, as I said earlier, that in terms of children's mental health, it seems to be the older children and then young adults who actually suffering. So it's definitely something to highlight.
Okay, thank you.
Thanks, Rob. Alison.
Thanks very much. Just a couple of points about levels of need at the moment for children and young people. We are seeing increased referrals into our multi-agency safeguarding hub for the primary school age children, where the main need is emotional well-being. So primary age children seem to be feeling this at the moment, and we're also really busy in the child and adolescent mental health service. That's had additional referrals. So the pressure is now, as well as projected for later, is first thing to say. And second, there is a trauma-informed board which brings together key senior leaders across the police, NHS and councils on a pan-Hampshire basis.
Okay.
And it would be good to link the Alliance in with that work. They've just had funding for some short bite trainings on trauma-informed approaches, 1,000 places across the pan-Hampshire area, which we are promoting locally. And on the trauma-informed side, in children's services, we've long had a number of experts in this, and in particular, Ian Hunkin, who used to run the Harbour School, has been providing online training in trauma-informed approaches for all teachers in Portsmouth all through the pandemic, and also the Harbour School had a pilot sort of trailblazing program where we took a trauma-informed approach used in America with looked after children and used it for excluded children to help them to reintegrate back into mainstream schools, the PACE program. So there's lots of expertise there that can be tapped into on the trauma-informed front.
Thank you. Yes, I know that the Children's Service is taking very much a trauma-informed approach and have done for many years, so that's great. I didn't know about the Hampshire.
I'll send you the flyer for their training, and
thank you. That's great.
Yeah.
Thank you very much, Alison. Cheers.
Thanks, Alison. Diane.
Thank you very much, Councillor. Just a quick comment. Fiona, thank you so much for all your work. Age UK Portsmouth are delighted to be part of this alliance, and there are all sorts of encouraging conversations going on behind the scenes which are feeding into the working groups. That the work is just huge. It's phenomenal, and I think we'll probably be doing it for a long time. Not just wrapped around the current pandemic, but I want to wish you all the best and thank you so much, and we'll carry on regardless, and I'm sure expand enormously. So thank you very much. And I did also just want to say to Councillor that I was delighted to hear about the training just then. I was going to ask that very question, and we'll be there, diary allows. So thank you both, but thank you, Fiona, and all the best.
Thank you very much, Dan.
Thanks, Diane, and thanks for your feedback about the training. As I'll just reiterate again, it was fantastic when I did it, and it's so worth doing if you haven't done it before. Siobhan.
I've got my mic off now. Thank you. With regard to work streams, Fiona, very informative. A couple of areas just wanted to comment on. Number one, the coordinated workplace training. Just wondered if MEC was going to be featuring in that for frontline staff.
Yes.
Great. Okay. Tick. And with regard to bereavement.
Yes.
I don't know if you know, but Healthwatch Portsmouth provided a really good resource for its host organisation, Help and Care, to provide those people at the Healthwatch Hub, which is a call centre for 8-9 Healthwatches in the local area, on the very subject of bereavement. So if that would help, we've got a resource which is immediately available for people to refer to, if that is something that could help provide extra support to what's being done here.
That's excellent. Yes, I'll catch up with you outside the meeting, and I think linking that with Paul Beeden, who's the lead of that work stream, he does actually host a forum across Portsmouth, so he may be aware of it, but it's very useful to make that link anyway.
Super. Right. Okay. Thank you for that. And finally, with the work regarding Shaping Portsmouth, we've mentioned it many times already, but is MEC going to be offered to those partners within Shaping Portsmouth?
That would be the intention. So we're going to be busy on MEC, but we're getting a rolling programme together for it. But yes, it's a good call for that.
Super. Thank you.
Thanks, Vaughan. Jackie.
Hello, and it was just a quick one for me. When I was looking at the membership of the organisations, I couldn't see anyone from Children and Young Persons Safe Voluntary Services. So would it be helpful to reach out to them in some way to see if they could also make a contribution, unless they are by other means?
Yes, that's fine, Jacqueline. So I'll link up with them, and then also link up with Stuart McDowell, who's leading, or who's our link person with the social, emotional, mental health strategy, because they may well be involved in that already. But if it's helpful for them to be on the Alliance as well, that's fine.
Thank you.
Thank you very much, Jackie. And I don't see any other people wishing to speak. So so we have the proposal for this particular item, which was put forward within that. So I hope everyone can support the recommendations in the report. And just to let everyone know as well, this report will also be coming to Cabinet next Tuesday. So we're both doing it as a system within the Health and Wellbeing Board, but also within the Council as well, which is really important, because this is absolutely critical to supporting people with mental health issues both in this difficult time, but actually working forwards as well. And just to reiterate as well, having been on the Alliance since the beginning, the way it's progressed has been so bottom up and working really, really well together. And I think it's really a great model of how you can come out with some really positive, concrete ways of doing things through actually working in that really collaborative way from the very beginning, and taking the time to do it properly as well, rather than rushing in and thinking you have to do something now, because having the way things are progressing now with the BAME event that took place a couple of weeks ago, with the debt events we've got next week as well, next Thursday, it's really positive, and it's going to make that real difference. And obviously linking it in with the training for everyone as well is really, really good. So and again, let's thank Fiona for all of her work on this, but also Gordon as well, who has been as co-chair from Solent NHS. Again, another great bit of partnership work, who's been absolutely fantastic as well in bringing people together and really making this alliance start to hum. Fiona, can I just ask you to stop sharing your screen now? That's all right, and we'll move on therefore to agenda item 9, which is the Health and Wellbeing Strategy Refresh.
That happened?
Yes, thank you very much, Fiona.
Okay, thanks.
Thank you, Yeah, thank you, Councillor Winnington. Again, just a really brief information report, just updating on the progress of the refreshed health and wellbeing strategy. A number of members of the board will remember that one of the last pieces of work we did before the pandemic came upon us was a workshop session looking at how we might approach a recasting of the health and wellbeing strategy, looking at more significant underlying themes in the city rather than the approach we've taken previously. My recollection is certainly that was a really energising session. There was a lot of positivity in the room about taking things forward in that way. Unfortunately, we've been slightly strained in capacity in progressing that over the last few months. But obviously recognise that this is an important piece of work that we need to get on to doing in terms of underpinning some of our other approaches. And we're very keen to do that. So really, this is just to remind the board that we did that piece of work. We haven't forgotten about it and remain really keen to take that forward. We're looking to develop that work, taking account of the context we now find ourselves in, which is obviously different to that when we looked at it last February. And also to place it in the context of some of the other pieces of work you've heard about today. So the Imagine Portsmouth visioning work, the work to refresh the health, the blueprint for Portsmouth and the wider healthcare Portsmouth plan as well. So really just to bring this to you to say we haven't forgotten about it, we're keen to get on with this, we're expecting to pick it up again early in the new year. It will give us an opportunity to have regard to all the events that have happened this year and what we're moving into really in terms of that different way of working, and to have regard to those other frameworks around us. So just wanted to log it really at this stage. Thank you, Chair.
Thank you very much, Judith.
Does seem a long time ago, doesn't it? But one of the most inspiring parts of that workshop was the notion of a, if you like, a contract between us and the citizens of Portsmouth about what services will do and what they will do for themselves. And I think it came from one of the councils beginning with W in the north west.
I think it's the Wigan work, Councillor Hyde, yeah.
Wigan. I hope that Wigan work has survived, because I do think that is absolutely the heart of a high-level strategy, which is about people, citizens, understanding what services can and can't do, and also about all the many, in fact, you know, people's outcomes are much more determined by their own work, their own families, their own relations, than they are about any number of services. And that notion of co-production of a good life, good outcomes for people was one of the most inspiring things about that workshop, which I hope we're not going to lose.
Agreed. Thank you.
Thanks, Judith. And I think it's always worth pointing out that Wigan is a similarly extremely integrated place in terms of health and care and community providers, and in a different way from Portsmouth in the way they organise it. But it is again a very, very integrated authority area with health and social, with the very, in the very broadest sense, health and social care. So I think it's always good to learn from places that are similar to ourselves in terms of the integration. But yeah, thank you for the reports, Kelly, and yeah, and just to reiterate that certainly it hasn't been forgotten, but you can appreciate the fact that we are how this is going to move forward post pandemic. I think is something that we are thinking about now, and then we can really crack on with it as soon as we're able, and move it forward properly. Okay, so that brings us to the end of the agenda, and just about future meetings. The next scheduled meeting is the 3rd of February at 10 AM. And obviously within connected to that, there's then the sub-boards we've been talking about today that will continue be going through, and obviously the where we are at the 3rd of February, we will then report back in both with the Mental Health Alliance and also the member-led engagement board as well. We'll report back in on the 3rd of February. So thank you so much for everyone who's attended today. I really appreciate all your work that you're doing in all your organisations and all parts of the council, because without that, we would be in a really poor state in this city compared to where we are. So a really great thanks to all of you, and I hope you have a good rest of the day. Thank you very much.
Right, so we'll turn the
Thank you, everybody.
Right, we'll turn the live stream off now.
Thank you.
Thank you, Anna.
Thank you.
you.
Thank you. Keep safe.